Okay. I am now going to, before knocking on the door, I'm going to review the patient's order, the vital signs, everything is normal and within range. I'm going to now knock on the patient's door, provide privacy once upon entering, and I'm going to wash my hands for 20 seconds per CDC guidelines and don gloves while I go ahead and introduce myself. Hi, my name is Gaston. I'll be your nurse today. Can I go ahead and have your name and date of birth?
Crystal Garcia, March 16, 1994.
Thank you, and the records match. Crystal, do you have any allergies today?
No.
No allergies? No allergies to iodine, latex, shellfish, or seafood?
No.
Thank you. And I have a few questions for you. Do you know who the president is?
Donald Trump.
Do you know what year it is?
2020.
Do you know where you're currently at today?
Hospital.
And do you know why you're here?
I'm here because I'm getting a physical assessment.
Perfect. So the patient is awakener and oriented times 4. And a few more questions for you. Do you remember your most recent memory from last night?
I went bike riding.
Perfect. And do you have any assisted devices that you use to ambulate or walk?
No.
None. Do you wear contacts?
No.
Do you wear hearing aids?
No.
Do you wear dentures?
No.
Okay, and I see that you wear glasses. And I checked the Snellen chart, and visual acuity is 20/20 with the glasses. And I'm going to now start by further questions. Do you smoke tobacco?
No.
Do you drink alcohol?
No.
And do you use any recreational drugs?
No.
Perfect. So I will go ahead and start by assessing your scalp. I'm checking for any infestations, any lesions, any signs of pedicullosis, and hair distribution is even. That's normal. Now I'm going to assess your ears. Okay, I'm going to flash the pen light and on both sides. Okay, no signs of dryness. Mucous membranes look normal. And can you go ahead and lift your arm on what side you hear the noise? Perfect. Patient's hearing is normal. And now can you go ahead and take your glasses off for me? Okay, your your face is symmetric, and your eyes, sclera, look white. So there are no signs of jaundice, no signs of dehydration as well. You can go ahead and put your glasses back on for me. And I'm going to check your skin here. Your temperature is normal. It's not cool or clammy. And can you go ahead and lift your head up for me? Sorry. Okay, and I'm checking the nostrils here for any inflammation, any swelling, any redness. Everything is normal. The membrane walls look normal. And you're judging by your lips, they're not cracked, so no signs of dehydration. Can you go ahead and say "ah" for me? Open your mouth. Okay. No signs of ulcers, no signs of lesions. Your tongue is not swollen either. And can you go ahead and close your eyes for me? Can you smell this?
Smells minty.
Okay. Patient's olfactory nerve is intact. And do you have any trouble swallowing?
No.
Okay, I'm going to ask you to drink this cup of water. Okay, patient can swallow. No signs of any issues with swallowing. And now I'm going to assess your lymph nodes. And by doing that, I'm going to check the submental, further down to the supraclavicle. And then can you expand your arms here for me? I'm going to check the axillaries. Okay, the patient's lymph nodes are normal. They're not swollen. There are no signs of tenderness. Did you feel any pain? Okay, patient states no pain. And on a scale of, do you have any pain today?
No.
And on a scale of 0 to 10, do you have any pain?
No.
What would you rate your pain on a scale of 0 to 10?
0.
Perfect. Patient states no pain. And I will go ahead and assess your range of motion with your arms, if you can sit up for me. Okay, I'm going to go ahead and shrug your shoulders up. Perfect. Cranial nerve number 11 is perfect. And can you go ahead and, with your fingers, your hand here, go ahead and apply pressure up. Okay, and lower. And I'm going to now assess the patient's nails. And while I'm doing that, I'm also assessing the patient's skin turgor. And it's normal. And I'm checking capillary refills. And they're brisk, +2. And on both sides. Checking this patient's pallor, turgor. Okay, nails are normal, nails are clean, and patient's overall hygiene is normal. Patient's odor breath is normal as well. Patient's overall hygiene, mood is good and happy. And can you go ahead and flip your hands for me? Perfect. Can you go ahead and stretch your arms out? Give me a circular motion. Can you lift them up? Okay, put them down. And I'm now going to assess your lower extremities for capillary refills and to check your nails as well. Okay, they're brisk +2 on each side. Okay, and can you go ahead and move them in a circular motion for me? And with your heels, can you touch your shin on both sides? Perfect. And hair distribution is also even from your upper extremities and your lower extremities. Can you go ahead and lay back down for me? I am now going to assess your legs, your lower extremities for any redness, any edema. Okay, and it's normal. And while I'm here, I'm also going to be checking for the pedal pulse, for the post-tibial, and for the popliteal, and for the femoral. And I'll do that on both sides, pedal pulse, post-tibial, behind the popliteal, and the femoral. Excuse me. And now I'm going to check your pulse also on the upper extremities here with the radial, the ulnar, and the brachial for 60 seconds. And then bilaterally on the other side as well, radial, ulnar, and brachial. Okay, and now Crystal, do you feel any pain when you urinate?
No.
Do you have any discoloration?
No.
Do you see any blood when you urinate?
No.
And when was the last time you voided?
About 30 minutes ago.
30 minutes ago? And there was no pain or anything?
No.
Okay. And when was the last time you used the bathroom for bowels?
This morning.
Fecal. This morning? And was it liquidy, normal, regular?
It was a regular brown, not watery.
Perfect. The color was normal as well. I will now inspect your abdominal area. Okay, and just by inspection, I can tell that everything is normal with your skin. There's no signs of mass or swellings or lacerations. And so now I am going to auscultate the abdominal area and check for peristalsis, starting with the right lower quadrant, then the right upper quadrant, the left upper quadrant, and then the lower left quadrant. Okay, sounds are normal. And now I will go ahead and percuss each quadrant as well. And then following, I will now palpate as well. Let me know if you feel any pain or discomfort. Okay. And patient states no pain. Everything is normal. Bowel sounds seem normal. And no signs of obstruction in the peristalsis. I will now go ahead and assess your lungs. And by doing that, I will assess first your skin turgor on each side here. It's non-blanchable. And I will go ahead and assess for the 6 quadrants in the front for the lungs. Go ahead and take a deep breath. Exhale. Perfect. No signs of, no adventition sounds. Breath sounds seem normal in the front and the anterior. Now I will check the posterior in the back. If you can sit up for me. And now I'm going to check the 8 lung sounds on the back. Take a deep breath. Okay. Lung sounds being normal, and while I'm back here as well, I'm going to be assessing the spine. And the spine is straight. No signs of distensions or no signs of scoliosis. If you can go ahead and sit back for me. And now I'm going, do you have any trouble breathing? Do you have any trouble, do you feel any dysrhythmias at times? Any murmurs?
No.
No? And I will go ahead now and assess your heart sounds, starting with the aortic. And now the pulmonic, the herbs, the tricuspid, and the apical/mitral. Perfect. And now, the camera. Okay. And Crystal, do you have any? How do I say this? Do you feel like harming yourself today or anyone? Do you feel safe at work?
Yes.
Do you feel safe at home?
Yes.
Okay, and this, I believe this concludes our physical assessment. I will go ahead now and disregard my gloves. I will wash my hands. I will lower the bed, and I will raise the side rails. And then I'll ask you, Crystal, if you need anything else. The call light is right here. I'll be right outside. Just call me if anything. And then I'll document my findings. Thank you.
Thank you.